Hello, and my name is Rebecca Garcia. I'm the president of the Nevada PTA, and thank you for joining us for this session regarding child health policy updates. I'm excited to be joined today with Leeann McAllister. She is the executive director for the Nevada AAP. And welcome, thank you for joining us. And could you just introduce yourself and the Nevada AAP a little bit more?
Sure, thanks so much for having me, Rebecca. So the American Academy of Pediatrics is a professional association for board certified pediatricians, both primary and specialty care. Across the US and Canada, there are over 67,000 members. And here at the Nevada chapter, we have 280 members. So we're one of the smaller chapters for the American Academy of Pediatrics. Altogether, there are about 65 chapters for the American Academy of Pediatrics. Small states like Nevada just have one, but large states like California have 4 different chapters.
That makes a lot of sense. So today we're going to be talking about child health policy. And I know sometimes that doesn't sound like a super exciting topic, except for those like you and I who have an interest in it, but it really does affect all families in many different ways. So can you share a little bit about why the American Academy of Pediatrics gets involved in child health policy and kind of the process about how you get engaged?
Absolutely. So the American Academy of Pediatrics, we call that AAP for short, and then the Nevada chapter, we usually say Nevada AAP, is dedicated to the health of all children and has been for over 90 years. And so throughout the long history of the Academy, advocacy at the federal and state and local level has been a primary driver. Actually, one of the first things they did is help to get funding for prenatal care for moms about, just over 90 years ago now.
It's always interesting to see how some of those things originated. National PTA has been involved in some of the things like school busing that we just think are totally normal now. But decades ago, those were unusual things that people weren't thinking of as just a standard practice. So what are some of the national priorities now for the Academy?
Sure. So I think, as you know, working with the schools and the PTA, there are so many advocacy and legislative policies that impact children's lives. It can be an overwhelming number of different topics. But right now at the national level, the Academy is focused on 5. So first would be mental health care, making sure that kids have access to the right care in the right setting at the right time. And then beyond mental health care, just care, access to care in a medical home, that every child in America has an established provider of care that they go to on a routine basis to receive their immunizations, to build a rapport with a trusted medical provider, so that when things arise in their health lives, they know who to go to, where their medical home is. The third major issue for the Academy right now is gun violence prevention. It is gun violence prevention and accidents in general is a leading cause of death for children. So we do a lot of advocacy work around that. Tobaccos and e-cigarettes, which I know you and I have collaborated on, is a major health advocacy priority right now. And then lastly, children nutrition and healthy weight.
And so many of those overlap with both Nevada PTA priorities and national PTA priorities, because we know how important it is for kids to be healthy. And I think, you know, as a mom, that one about having a medical home, and I love how you put that, a medical home, is really important, because I know that when I've had a pediatrician who felt like they were my partner with my kids, it completely changed the things I shared with the pediatrician, the questions I asked, the services that I wanted to figure out how to take care of for my kids. And so that consistency, which I think in Nevada is a real struggle often for folks because we have so much move in and move out, is really important. And obviously gun violence is something that National PTA has long been championing, reasonable action to ensure. And I think where that overlap is is the importance of making sure that kids don't have access to guns. Like that legal gun ownership isn't what we're looking at. It's making sure that kids don't access guns. And we just had a tragedy here in Las Vegas this last week again. So important to look at those, as well as childhood nutrition. For those tuning in, National PTA has released our national legislative agenda for the summer, and childhood nutrition is one of the items on it, as well as mental health. So we skipped over that a little. I skipped over that a little bit. You didn't. But with mental health, could you share a little bit more about what pediatricians really feel like is important from a policy perspective? Because it's something I think we're all talking about, right? We're all saying kids need mental health support. But I think sometimes when we just say those words, it's hard to actually say, okay, from a policy perspective, what do we actually put into practice to make sure that happens?
That's a great question. Actually, just last month, I and 5 of my members, 5 pediatricians, we had a meeting with Senator Cortez Masto. And we were talking to Senator Cortez Masto about best practices that are working in Nevada and across the US, and co-located mental health care in a doctor's office is a great best practice. So you see your pediatrician notices some orange flags, and then you have the mental health professional right there in your clinic to do that warm handoff between the pediatrician and the counselor. That is the best practice, but not all pediatricians and not all pediatric providers have that type of co-located access. So I think it's about 5 years ago now, the federal government funded pediatric mental health access lines. And these are peer-to-peer, doctor-to-doctor conversations between the pediatric provider and the child psychiatrist to consult with each other about the best next steps for a particular patient. And here in Nevada, we just had our first line launch. Dr. Lisa Durrett from UNLV launched the PAL line. And pediatricians like my husband, when they have a kid in the office and there's some orange flags and some concerns, and he's not 100% sure of what's the next best step for this child, he calls Dr. Durrett's PAL line and he talks with her, he talks with one of her fellows and gets some real-time one-on-one consultation on how best to treat that patient in his office and what are the next steps and resources available. It's really been a great advantage here in Nevada since that's launched. So when we met with the senator, we talked to her about ways the federal government can help to expand that funding to also bring some of these services to the schools and the counselors there as well.
That does sound like such a necessity to ensure that pediatricians can actually reach out to somebody. Because I know myself as a parent, when you leave with a referral, you're waiting for your insurance to process it. Then you're waiting for an appointment to meet with that psychiatrist. And we know in Nevada, there aren't enough pediatric providers for mental health in general. And so it's making sure that the pediatrician has access to that direct guidance. I hadn't thought about that. And it's such a good way to do it, recognizing the shortages that we have. So yes, that makes a lot of sense.
And in addition to that, out of the University of Nevada in Reno, there are the Project Echo projects. So any pediatric provider, actually any health provider, I'm more familiar with the pediatric echoes, but any health provider who has a case needing specialty consultation can present that case in a peer-to-peer environment. And what we're doing is we're empowering those providers who are on the ground anywhere in the state to become more aware providers in their own clinics to provide that type of care right there in the primary care setting. So there are resources in Nevada, and in the 4 years that I've lived here, have seen them really flourish.
That makes a lot of sense. So we started at the national level. We've already started talking about Nevada, but what are some of the other healthcare priorities for Nevada? You and I have had this conversation a number of times. Nevada is a really unique state. And every time we say that, whatever setting I'm in, people are kind of like, yeah, you're a quirky little Western state. Okay. But I mean, we have rural, urban, teeny tiny school districts, teeny tiny towns, been the center of hospitality in the world, Las Vegas. And we have so many families that come from different countries and different states. So we're this very transient community. We also don't have a very educated population, which I'm sure affects healthcare. So what are some of those child health policies that pediatricians are seeing here in Nevada that need to be addressed?
Sure. And I do survey my members on a regular basis to see where their advocacy priorities lie. And for the most part, they are in line with those 5 priorities that the Academy is addressing at the national level, with the addition of immigrant child health on top of everything. So, right, last I heard out of Pew Research, 19% of Nevada is undocumented. And for kids in the state who are citizens who have legal access to Medicaid, their families might not always feel comfortable accessing the resources that they are entitled to, whether they be SNAP benefits, Medicaid, other benefits, WIC. So we have resources here that go underutilized because immigrant families don't feel comfortable accessing them. And so pediatricians, through me and through our advocacy partners, are doing what we can to encourage families to take advantage of the resources they are entitled to, and that can make such a difference in the long-term life of their families by accessing those services now.
Are there specific issues that you've worked with at the legislative level or challenges that you feel like still really need to be addressed as it sounds crazy, but we're getting ready to head into another legislative session before we know it. And things happen in the interim too. But what are the ways that pediatricians locally are feeling like things could move a needle for kids at the state level?
Sure. So a lot of it has to do with enrollment. So I was just talking about people who are eligible but not enrolled. That's a big concern. But an equal concern are people who are eligible, enrolled, and then are constantly falling off of the rolls. We call it Medicaid churn. I do feel like we have a really good partner in the Nevada Medicaid program. I've heard several of their leaders talking to the legislators about giving our state some advantages other states have, like 12-month continuous care or 12 months of postpartum care without having to revisit and kick people off. When we lose that continuity of care for a kid with and without complicated health issues, they just fall out of the habit of preventative care, which then leads to things that we miss and bigger problems down the line. So what we worked on last session and we'll be working on next session will be that continuous care. It's been one of the strange silver linings of the pandemic, actually, because we've been in a national health emergency. No one has lost their Medicaid coverage. So no one, and we don't know when the national emergency will end, but when it will, we'll go back into that cycle of people, they get a seasonal job or a temporary pay hike, and now they lose their Medicaid benefits and they don't have access to that care, and they have to fill out paperwork, or they moved, or the mail didn't reach them. That is just heartbreaking when you're a pediatrician and you're trying to provide continuity of care for a kid dealing with anxiety, or they're on the autism spectrum, or whatever health issue you're addressing for them. It doesn't happen in one visit. It happens in a series of visits over weeks, months, years. Keeping them connected to Medicaid keeps them connected to the pediatrician.
It's always interesting how it's many pieces linked together that make a difference. It's not just about finding a pediatrician, it's being able to keep that relationship. It's being able to make sure you have insurance that will pay for that relationship, so that kids have the services that they need. Because we know that when kids are healthy, they learn better, they succeed, and early recognition of challenges is so important too. I know as a parent, I've seen that, and pediatricians are your first stop so often for help. I need, even for learning challenges. A lot of people don't realize that your pediatrician is your first stop often for an evaluation for your child for neuropsych issues. So it's that first line that's so important. I you mentioned, kind of a silver lining of the pandemic, and I don't want to go backwards into the pandemic. We all lived enough months of that, right?
Yes.
Nobody wants to go back to it. But I was recently reading an article that raised some concerns about childhood vaccines, and that whether it's from delays or hesitancy, there's concerns among public health officials that not enough kids are receiving their regular scheduled vaccines. Is that something that pediatricians are expressing a concern about here in our state?
Oh, absolutely. I hear from my members all the time. The frustration they feel in arguing against the false misinformation that families are finding online. And at the national level, the American Academy of Pediatrics has been working with not only the White House, but with the different social media platforms to remove fake information and misleading information from the internet. It's overwhelming for a physician to spend their whole career through training and education and continuing education, and then to be confronted by a parent in the examining room questioning their integrity and questioning their ethics, that they believe the person in front of them is lying to them because they read something online that was just false, just not true at all. So I think where the pandemic really harmed us is because people fell out of that routine of seeing their doctor every year, seeing their pediatrician every single year, keeping that relationship and that rapport. We have to do some work to build that back, because it's through that relationship and the pediatrician getting to know the family, listening to the family. Your pediatrician wants to be a resource to you and answer your questions. Absolutely, or should ask the questions that you have. I think where they get frustrated is when they're not answering questions, they're fighting with someone who's telling them they're wrong. And so that's where the burnout comes, I think, in the healthcare field.
And I think that's very real. So many people are feeling that burnout and the false information that is so readily available. And it's hard sometimes to weed out what is accurate information versus an article that, quite frankly, some of the times they look legitimate. They look like they've got research behind them and all this information. So how can parents and PTA leaders who are trying to share good information with their community about child health get that type of information from pediatricians? I know the AAP has resources. How can families access those?
Right. So our favorite resource is healthychildren.org. Healthychildren.org is the American Academy of Pediatrics parenting advice website from 67,000 pediatricians. All articles are in English and in Spanish on any health condition, and every article tells you the last time it was updated. They're always continuously being updated with the latest information. As a parent, as a practice manager, I have consulted healthychildren.org so many times. So please utilize that. Beyond the website, there's now the Pediatrics on Call podcast. And it is for pediatricians, but it's also for parents, and has wonderful insights into different pediatric health topics that parents are often overwhelmed or confused by contradictory information, and the podcast can help to sort out a lot of the details out there. I think in healthcare and in medical decision-making, it is often challenging because there are areas of gray, right? Nothing is black and white. There is no one size fits all when it comes to healthcare. And that is why an individual relationship between you and your child's pediatrician is so critical, because you want the care to be tailored to your child.
Yeah. It's interesting how in education and healthcare, I always find so many parallels, because it's the same thing, right? When you have a relationship with your child's educator, so many great things happen because you feel like you have a partner and you can collaborate and you can problem solve and get your child the best that you need. And the same thing is so important in healthcare, especially I think mental health providing, because it is getting to the mental health provider. I feel like in Nevada is such a challenge. So having the ability to more easily bridge that gap is really important. I also wanted you to give a plug because I know these are available, and I actually just watched the last one you did. You guys do virtual walk with a doctor. Can you share a little bit more about that and how people can watch those?
Sure, absolutely. So Walk with a Doc is an international nonprofit. They have chapters all around the world, through the US, through Europe, through Africa. They're everywhere. And here in Nevada, we used to run two, one in Las Vegas and one in Reno. And then with the pandemic, we went virtual. So the second Sunday of every month, I have a pediatrician who gives a very brief, kid-friendly health talk on a number of different topics and then takes questions live. And then we house all those videos on our website and on YouTube so that families can watch them. And then about a year and a half ago, we introduced Camine con un Doctor. So we do it Spanish language once a quarter as well. For families who want to suggest topics to me for what we should be covering in Walk with a Doc, I welcome families to reach out to us. My contact information is on our website, nevadaaap.org. But that is a way for us to take national, sometimes international health news and bring it to the specific Nevada population through Nevada pediatricians.
I appreciate that, because I always find that the topics are things that I've had questions about, or I know parents are asking about. So I found them to be really relevant. And I love that they're short and accessible and available on Facebook afterwards. That's always, I rarely catch, it's right in the middle of my church. So I can never catch it live, but it's always good to watch later in a simple format. So Leeann, thank you so much for joining us. Is there anything else you want to share with our members before we sign off?
Just one more thing. So for families out there who do want to get more involved with advocacy work, legislators want to hear your health stories. They want to know what is happening in your family and how they can help change policies and laws to improve things, not only for your family, but for families having similar situations. Both the Nevada chapter of the American Academy of Pediatrics, but also our advocacy partners, especially the Children's Advocacy Alliance, work a lot with families who want to get more involved for their specific family health story. So don't be shy, reach out to us and let us know if you want to get more involved. We're always happy to engage.
I appreciate you sharing that. One of the things that we're trying to do and why I wanted to have this presentation with you was exactly that, to help parents be more aware, families and educators be more aware of what are some of the topics and who's out there in the space trying to advocate to do things. It's hard because all of us have a lot on our plate, and I know I end up testifying a lot about education, but there's some child health topics that are near and dear to my heart as a mom that I don't always have time to do. But I would encourage people, just like you said, it's the stories that matter. That's, you know, you as an executive director can talk all day long about what pediatricians want. And when you have a child or a parent come and share the story of how it truly impacted their family, that's what a legislator is going to remember. Let's just be honest. And so would encourage folks to get engaged in whatever capacity you feel comfortable. Like you said, Children's Advocacy Alliance is a great organization here in Nevada as well, and they cover a lot of from birth on issues for kids. And of course, always with PTA, we're glad to have people join us, and we'll be putting together our legislative priorities. That's part of our convention this year, is asking for some feedback on what members want to see our legislative priorities be. Like you said, we're always asking those questions. And so, because it really comes down to, if we want child health policy to match the needs of our families in our state, those stories have to get out there in order for people to see the need and make changes.
Yes, absolutely. Absolutely.
Well, thank you, Leeann, and thank you to the pediatricians in Nevada. I think there's a special place for pediatricians because it's just such an important role in children's development to make sure that there's a pediatrician watching over and caring for them in a productive manner. and grateful for those who are doing it, especially in Nevada when we don't have enough. I always feel like that's always my saying. We don't have enough. We don't have enough. We need more. So thank you, Leeann, and thank you for being with us today. And for everybody watching in, we will include the website links that Leeann mentioned underneath in this video so that everybody can easily access those for more resources after we're done.
That's wonderful.
Thanks so much.
Thank you, Rebecca, and thank you to all the parents who are so involved. As a parent myself, I know how difficult it can be, but it's just so important to show up for our kids. So round of applause to everybody.
Thank you so much.